According to a general survey on mental health problems in 2016, it revealed that around 7 million of Thai people aged 18 years and over are suffering from mental health problems, mostly found in 5 disease groups, including depressions, mental disorders known as schizophrenia, anxiety, intellectual disability, or cerebral palsy, and also complications from drug addiction, such as narcotic and alcohol. Meanwhile, a survey on mental health problems among people aged 18 and over in southern Thailand, specifically in Pattani, Yala, Narathiwat, and Songkhla in 2016, has also been carried out. And the survey results states that in 2016, the rate of psychiatric illness was 3.4% higher than its average of whole country surveyed in 2013, which is at 3.2% only. Besides, the study also found that the number of psychiatric patients with complex psychiatric problems being under the treatment from experienced psychiatrists and in the Songkhla Regional Clinic Psychiatric Hospital has increased from 481 people in 2015 to 750 people in 2017. According to the information provided by South Watch Center, especially Deep South Incident Database (DSID), the records claims that during January 2004 to April 2017, there are a total of 19,279 violence incidents during this period that caused 6,544 deaths and 12,963 people were injured. In conclusion, since 2004 until 2016, there are 19,507 people died and injured due to unrest situations in 3 southern border provinces within these 13 years. KhokPho District, Pattani Province is the red zone that has a population of 66,840 people living in serious risks on life and property. As a result, people have to live in remote areas in poor conditions. Disadvantage as government officials have difficulty assessing them. From such a situation, it has resulted in the increasing of psychiatric patients in KhokPho Hospital, Pattani Province. The rate increased from 207 patients in 2015 to 2018 to 328 patients, representing 2.5% of the population. As KhokPho Hospital is a local community hospital, it does not have any psychiatrist doctor ready to function. Only 2 psychiatrist nurses in charge of patient care that they have to give mental health care to 54 people in 8 hours in the outpatient department, and that in 2015 there were 23 cases of psychiatric crisis representing 11.11%. From the problem, a project entitled Patient Monitoring System for Rehabilitation of Psychiatric Patients in KhokPho District, Pattani Province, piloting in Naket District, KhokPho, Pattani Province, has been implemented. The project network finally expanded and covered 12 districts of KhokPho District of Pattani Province. The objective of the project is to develop the psychiatric service system by cooperating with network partners in the area in order to be able to reduce the severity of psychiatric illness from crisis and to increase access to services. The strategies of the project are: 1. By developing the potential of network partners. Thus, mental health and psychiatric training on psychiatric disease and psychiatric emergency, psychological negotiation techniques dealing with aggressive psychiatric patients, and patient referral has been held for psychiatry health officials, community leaders, religious leaders, village volunteers, psychiatric patient caretakers, local rescue rangers in each sub-district. 2. By developing and making the individual psychiatric patient data management on database system of the 12 sub-district presently updated similarly. The data classification also made based on the Global Assessment of Function or GAF by dividing into 3 colors as in the traffic lights, which are red, yellow, and green, and measures are taken care of according to the severity. Moreover, the implementation of violence-based mental care measures has resulted in effective process of monitoring and preventing recurrence of psychiatric emergency in each area. For instance, by preparing the tracking form and appointing a person responsible for psychiatric patients in the community. Psychiatric care in the community by the participation of network partners of KhokPho District, Pattani Province. 3. By getting access to psychiatric patients more effectively. This could be done by developing an exclusive clinical services for psychiatric patient system, by coordinating to all to treat the patient fairly, and by using refer in, refer out, refer link, and refer back system for rate label patients. In areas with high conflict from unrest situation, shared mental health care between staff and community partners are professionally applied by using participatory processes of network partners as if the cases are owned by themselves. Consequently, number of psychiatric patients in red has been downgraded to yellow and green respectively, and so the mental health service plan has been developed. Operating procedures of developing of treatment system and access to services. An effective emergency psychiatric delivery or referral system with the participation of community partners. Performance outcomes are as the following. 1. The symptoms of relapse of psychiatric patients has decreased from 15.24% to 5.22%. Number of rate label patients reduced by 44.44%. 3. Rate of psychiatric patients referral reduced by 50%. 4. Rate of access of new psychiatric patients to services increased from 61.30% to 72.12%. 5. Cost of medical treatment for psychiatric patients reduced by 40%. 6. Cost of traveling spent by the family of psychiatric patients in order to receive treatment at psychiatric hospital reduced by 60%.